World Asthma Day is recognized across the world on the 3rd of May. This year, the theme is Closing Gaps in Asthma Care. The day, of course, set aside to raise awareness about asthma and how those battling the condition can best equip themselves.
Well, according to the World Health Organization, asthma affected an estimated 262 million people in 2019 and caused, get this, 461 deaths. That's 461,000 deaths. So we're going to unpack it further with our pediatrician, Professor Claudia Gray. Prof, thank you so much for your time this morning. I don't know how much information and how much awareness is being cast on asthma, especially in the South African context. I mean, do we always bring to light and to the spotlight just around the causes, the treatments, how does one get it, and the like?
Yeah, so Faith, I think the most important first thing to say is that asthma is the most common non-communicable or non-infectious disease worldwide and in South Africa as well. So it's a common disorder. The prevalence ranges probably from 5 to 20%, which means 1 in 10, even 1 in 5 people have asthma at some stage of their lives. So it's incredibly common. It's an inflammatory condition of the airways. So essentially, the airways, the little trees down in your lungs, become inflamed. And that means they become quite twitchy or quite hyper-reactive, and they close way too quickly, leading to symptoms such as coughing, wheezing, which is a whistling when you breathe out, and shortness of breath. And of course, there are many triggers that can trigger an asthma exacerbation, such as pollution or allergens or exercise or stress or infections. I think we all know somebody with asthma. We all know somebody with an asthma pump. And I think everybody needs to be educated that primarily it's an inflammatory condition. So an anti-inflammatory medication such as inhaled steroid pumps are the mainstay of treatment, and actually absolutely vital to good asthma control is a daily anti-inflammatory pump or medication of sorts.
Professor, can you be born with asthma? I mean, half the time, of all the times at least, where I have known people who've been diagnosed, if I'm using the right word, with asthma, it's always been, it's caused by something. You have asthma because you've used a nebulizer far more than you were supposed to when you were dealing with a cold. I myself, and Faith, please don't judge me, I had asthma. I don't know how severe it may have been, because the one time I decided as a child I'm going to have a sip of paraffin. And then my father then had to deal with that by, having me drink a glass of milk. And then suddenly when I got to the doctor, they were like, ooh, asthma. It's sort of kind of creeping up. Luckily, I didn't have to use a pump. But what I'm basically getting to is that a lot of the times when I've come to understand the prevalence of asthma, it's because it was man-made, for lack of a better word.
Yeah, I don't think yours was really man-made. I think you probably had a case of paraffin pneumonitis or an inflammation of the lung caused by the paraffin itself. So that's a different story. But that's just a good illustration of many misconceptions around asthma, isn't it? That it's sort of your fault. The bottom line is that it's multifactorial, as are most things in the medical world. So many factors act together. And certainly a very strong component is the genetic or the hereditary one. So you've just got the genes that eventually say you're going to have asthma. But the genetic predisposition is almost always coupled with what we call epigenetic factors or things above the level of the gene, which are normally environmental factors. And their modifiers, such as recurrent infections or airway pollution or airway irritants or tobacco smoke in the house, can make a difference in how you transcribe your asthma genes, so to say. No, people are not born with asthma, but they can be born with a tendency, the predisposition to develop asthma later if there's a strong family history. So we very rarely diagnose asthma in the first 2 years of life. The reason being that many common infections and bronchitis episodes and flus and RSV can mimic asthma. So in the young child, we tend to say, look, they're viral-induced wheezes. But later on, if we see that multiple factors are causing the cough and the wheeze, such as if we go for a stringent run or if we breathe in cold air or Whenever we laugh, we end up coughing, or whenever we're upset or stressed, we end up wheezing. So if there are lots of factors that trigger your airway hyperreactivity, together with a couple of airway tests, that then deserves the diagnosis of asthma. Essentially, the answer is we are not born with it, but we are born perhaps with a genetic predisposition. And usually with asthma, because there's so many factors involved, we can't blame it on one thing, such as having a nebulizer when we were young. I'm sure that would have been well deserved in a time of bronchitis.
Yeah. Prof, you know, when we're looking at also the fatalities, unfortunately, 461,000 is a lot. And I mean, when we're looking at it also, bringing it home to the South African context, one wonders, with the inequalities when it comes to our healthcare system, when it comes to the inequalities in terms of our socioeconomic climate, those that are living in the rural areas or peri-urban areas, how much attention do they get in being able to diagnose asthma, being able to treat asthma, and also be able to be given the necessary care that is due? The inequalities, does it not further exacerbate the numbers that we're seeing here when it comes to fatalities?
Absolutely, Faith. So I think when you read out some of the statistics from the World Health Organization, South Africa ranks 25th in the world in terms of asthma prevalence. In other words, what proportion of the patient has asthma. But we actually top in the world in terms of asthma mortality. So how many people die from asthma, or which proportion. And this is a very sad moment for us in South Africa, because essentially asthma is one of the conditions which is very easily treatable if you have the right combination of controller and reliever medication. And the fact is that our clinics, our hospitals, all of them are equipped with all of these medications. So it's not a shortage or unavailability of treatment. I think it's more of a lack of education around the fact how asthma needs to be best treated. You know, this notion that you just quickly take a pump to open up your airways whenever you need it is completely incorrect. Asthma is way better treated with a daily anti-inflammatory pump, for example. So I think education is a problem. Availability of medications is there, but of course some people don't have the luxury of instant access to healthcare.
Such are the inequalities, or such is the situation at least, where South African health is concerned. Professor, thank you so much for joining us here on the South African Morning. That is pediatrician Professor Claudia Gray, of course.